Make my little spiel. Good morning. Thank you for coming. If you have a cell phone, if you could please silence it, it'd be greatly appreciated. And Zoomers, you are muted, and please stay muted. And you can ask questions afterwards in the chat. And ready to go, Joe?
Okay, is this on?
Yes, it is.
Yes, it is. Okay. Let me see if my thing works. Yes, it does. Okay, well, good morning, everybody. This is the last in the series of Everyday Magic. And what we're going to talk about today is modern medicine, which happened only 90 years ago, the year I was born. And that was the year that we discovered sulfa. Before that, we didn't have anything. And sulfa is not really an antibiotic. It's what they call a bacteriostatic agent. So what it does, it kind of knocks down the bacteria enough so that your immune system can have a go at it. The first true antibiotic was penicillin, and we didn't get that until 1940s. So before 1935, if you got a bacterial infection, you got well on your own or you didn't make it. I mean, that's the way it was. And then since then, we've discovered the vitamins. We've got many, many more antibiotics. And we have antibiotics now that can treat diseases that were real scourges, like leprosy. I think there's one leprosarium in the entire United States because we now have dapsones and other drugs that can treat leprosy. Same thing with TB. When I was a medical student, we had 5 tuberculosis hospitals in Baltimore. I don't think we have one left because now we treat TB as outpatients. We have antibiotics that can control it. But so we have more antibiotics. We have hormones. We have cortisone now, which we didn't have before. Most of the medicines you see advertised on television are so-called biologics. And that's a whole new group of medications that can treat diseases that otherwise we couldn't do anything with. The insulin we have now is genetically modified. It's human insulin made by bacteria. And so we don't have to worry about people, diabetics who might be allergic to certain animal insulins. And so instead of having every pancreas in the United States from every abattoir go to Eli Lilly for insulin, now the E. coli bacteria make it for us, and it's human insulin, so we don't have to worry about allergies. And then, of course, we have antivirals, which are completely new, which can treat diseases we never could treat before. We have anesthetics, which you take for granted, but imagine trying to do any kind of surgery without anesthesia. And during the Civil War, the hallmark of a good surgeon was how fast he could operate, because you would give the patient a slug of bourbon, 4 strong men held you down while they amputated the leg. It was brutal. And so modern surgery is really a phenomenal thing. And then one thing which is not listed on the list here is the vaccines, which are really the greatest improvement in modern medicine ever. So what happened before 1935? Well, maybe you know the story about Ehrlich and the magic bullet, Salvarsan 606. It was the first treatment for syphilis, and it was an arsenic compound, and it was called 606 because that was the number of the compounds that he tried. And it didn't cure syphilis, but it did help. That's all you had. And then we had earlier anesthetics to ether. We had chloroform, which was used mainly for childbirth. And then we had the nitrous oxide or laughing gas for painless dentistry. And then, sterile surgery came along, and maybe you know the history of so-called childbed fever, where pregnant women during delivery would get infected because the doctors didn't know that they were transmitting disease with their hands that weren't washed. Then we didn't know what caused disease, so we have malaria, which means bad air. And they were sort of right. The air was bad because it was full of mosquitoes. And they're the critters that carried the disease. But it was a long time before we figured out about insect vectors. And part of the problem in building the Panama Canal was control of malaria. And that's what Walter Reed was famous for. And then we developed so-called evidence-based science. And that is an incredible concept when you think about what old medicine was. Galen in the 2nd century wrote a compendium about disease, and for 1400 years, that was what physicians did. And disease was believed to be an imbalance of humors, yellow bile, black bile, phlegm, and blood. And the treatment, of course, was to get these humors in sync with each other. And so what were physicians doing? They were bleeding and they were purging, which is probably the two worst things you could do to a sick patient. But there it was. And then in 1543, we learned about the anatomy of the human body with Vesalius. William Harvey in 1628 described the circulation of the blood. In 1833, William Beaumont had a patient who, because of a war injury, had a fistula from the stomach to the outside. And so he could put a probe into the stomach, and he discovered that the stomach has acid. We didn't know that until then. And then in 1846, Semmelweis was the pioneer in sterility and the idea that you transmit disease simply by having dirty hands. And so after a while, we recognized the causes of disease. And there are a lot of causes, as you can see. And the amazing thing is that we don't get most of these because our immune system protects us from them. But we start with the bacteria that we're used to. We then have viruses, prions, which are proteins that are folded incorrectly. They're rather rare, but they do cause devastating diseases, like mad cow disease. We have various fungus, mostly Candida. We have a lot of parasites, malaria, which infects the red blood cells, and then various worms that go in our GI tract and other parts of our body. Rickettsia, which are an exotic type of bacteria, mainly causing Rocky Mountain spotted fever and things like that. And then we have things that we call diseases that were really deficiency diseases, vitamin deficiencies, but we thought they were diseases. And so when we discovered the vitamins, we discovered the causes of them. And then we have inherited diseases, congenital, inherited from our parents. And we're now beginning to get a handle on some of that by doing some therapy to change the genome. And the classic in that is Leber's congenital amaurosis, which is a blindness that you inherit from your parents. And it's caused by one amino acid on one gene, which is wrong. And we now have the ability to correct that. And so we infect the eye with a virus, an adenovirus as a vector, and we can prevent these children from going blind. So that's the beginning of our treatment for various inherited diseases. And of course, the next one up the line is probably Huntington's disease, which is a genetic mishap, and they're trying to work on that. And then we have the various insect and animal vectors. And so if we start with bacteria, they infect every part of our body. We have the respiratory infections, your pneumonia, your tuberculosis, whooping cough, which hopefully we will not see a case of. It's a terrible disease, and it's prevented by the vaccine. And then we have Legionnaire's disease, which crops up periodically. We have diseases that infect the gastrointestinal tract, classic of which is cholera. But you read about salmonella, which tends to infect chicken, and some of the others, the Shigella, which usually causes a diarrhea. And the problem with things like cholera is we don't have really good treatment, but you maintain the patient. In other words, you have to hydrate them and keep them from becoming too hydrated. And then we have cellulitis, bacteria that infects the skin, and boils, which are basically infections. And there we have staphylococcus, and we have this thing called necrotizing fasciitis, which is a really nasty disease and is treated surgically. There's no antibiotic that gets it. You just have to cut out all the tissue that's involved and try and get ahead of it. And then, of course, we've always had the sexually transmitted diseases. The classic, of course, is witch syphilis, but we have gonorrhea, and this used to be rampant. And I had a book from my grandfather's library, which was What a Young Man Should Know. It was written by a bunch of clergymen. And of course, one of the things it said was that if you masturbate, you will go blind. Well, it turns out in that time when the book was written, that was true, because there was an epidemic of gonorrhea. And the gonococcus, when it gets into the eye, is devastating. It does cause blindness. So they were right, but fortunately we have antibiotics. And then we have bacteria that infect the bloodstream, which is serious. And then if it gets into the brain and the central nervous system, we have meningitis. The toxoid from tetanus, it isn't the tetanus bacteria, it's the poison that it makes that causes the problem. And so we have Texas toxoid, which is an antitoxin. And then we have other diseases like Lyme disease and leptospirosis bacteria, and botulism from spoiled food. And so if that's not enough, we have the viruses. And this is just a short list of all the viruses that can affect us. But chicken pox was a passage of childhood. Chikungunya, which you never heard of, it's got a great name, but we're going to see more of that because it's mosquito-borne. And then, of course, we're more familiar with the coronavirus more recently, COVID. But we have dengue, we have diphtheria, we have Ebola, hepatitis, HIV, mumps, monkeypox, norovirus, and then, of course, polio and rabies. So we have a lot of viruses which can afflict us, and some of them are transmitted by mosquitoes. There's a lot of fungus that attacks us. Most commonly is Candida, but we have other fungi. And most of the time, our immune system takes care of this. The real problem is in people who are immune compromised, people with HIV, because then fungus, which you never see in a normal, healthy human being, occurs, like the pneumonia that occurs, and the herpes virus is the zoster, which can destroy an eye, which you never see in a normal, healthy person, but we see them in the immune compromised. But then we have cryptococcosis, we have coccidioidosis, which is Rift Valley fever. We see histoplasmosis among people who raise a lot of chickens because the chicken droppings carry the fungus. And then the pneumocystis is something that we almost never saw until we had the epidemic of HIV. And that's a terrible pneumonia, which you just don't see in normal, healthy people. The prion diseases are interesting because it's an abnormally folded protein, and it's inherited. There's a gene, the PRNP gene, which mutates, and if you have that gene, you're susceptible. And the most common is Creutzfeldt-Jakob disease. Fortunately, it's quite rare. But the most other common disease is the mad cow disease. The others are exceedingly rare. But what is interesting is how we found out about the prion diseases in the first place. And that was because of a condition called Kuru, which was found in the 4A people in the South Pacific. And what these people are, they're ritual cannibalism. So if they conquer a people, they eat the brain. The idea was you get the essence of your enemy, and that increases your strength. Well, what they were doing was infecting themselves with this prion disease. And it took sometimes 20 or more years for it to become apparent. But that was how we first learned about prion diseases and that they could be transmitted from person to person. There are a lot of parasites that afflict us. The classic, of course, is malaria, which is parasitic on the red blood cells, and it's Plasmodium. Early on, the only treatment was quinine, and then we developed more effective treatments. We got Aralen during the Second World War, and the soldiers wouldn't take it because you turned yellow. It was a yellow dye in addition to being an anti-malarial agent. Now we have the hydroxychloroquines, and we have more effective treatments even than those. The other worms are common, and you see them more in the south. The filarial worms are the cause of river blindness in mid-Africa, and the tragedy there is that 25 cents worth of ivermectin will cure them, but they can't afford it. And so Merck gives them several $1 million worth of ivermectin free, because in Chad and countries around the river there, the so-called river blindness was carried by the black fly, the Simulian fly, and only the children had sight. By the time you were an adult, you were blind, and you saw pictures of children leading the blind adults with the sticks. We have tapeworms, we have other worms. The original treatment for obesity way back when was a capsule, which consists of a tapeworm scolex. So basically, you got infected with tapeworm. It worked, but they had to take it off the market. And so how do we get these parasites? Well, if you drink contaminated water, now the water we drink has a lot of stuff in it, and we discovered the hard way that you can't use it for making contact lens solutions, because there are things in the water that our GI tract has no problem with, but the eye does. And so now all of your artificial tears, all of your eye drops are not, we used to have salt tablets so people could make their own contact lens solution. That's gone, that's history. But if you eat undercooked meats, and the problem in this country is trichiasis, and that's in pigs that are fed garbage. Now in Europe, they feed the pigs grain, and it's not a problem. But in America, you have to cook pork well because of trichinosis. Fortunately, if you do get it, there are some drugs we have that will treat it. So the other problem we have, oops, let me go back one, is contaminated foods. And the classic there is salmonella, where you read about chicken that has to be recalled, various lettuce that has to be recalled because it gets contaminated in the field. And then, of course, we have the various mosquito bites, tick bites. We have contaminated surfaces, unprotected sex. And then we have contaminated soil, and that's usually a problem in the South where children walk around barefoot and they pick up some worms that way. The rickettsial diseases at one time were thought to be a separate category. We now include them among the bacteria. But they're the classic diseases like Rocky Mountain spotted fever and typhus. And the problem with typhus is it's carried by a louse, a flea, and you get it that way. So you get it in times when there's war, where people are in congested quarters, and it's a problem. We have a couple of other rickettsial diseases. Fortunately, they're not really of a problem. The vitamin deficiencies are interesting. Around the 1930s, a lot of diseases, or so-called diseases, were found not to be real diseases, but just deficiencies because of the diet. And of course, the classic we have was rickets, vitamin A deficiency. You had the kids with the bowed legs because of their need for vitamin A. And now we have, our milk is fortified with vitamin A, and we don't see very much of it. Beriberi, thiamine deficiency. And pellagra is interesting. It's a niacin deficiency. But that's why the rednecks got their name. They were eating hominy grits, which is probably has no nutrition whatsoever. Poor people were eating collard greens, which is very nutritious. But if you have a niacin deficiency and you're out in the sun, the part of your neck that's exposed, where the t-shirt ends and the neck begins, got red. You were sensitive to the light and you got a redneck. And that's how the rednecks got their name. They were basically deficient in niacin. Scurvy, of course, is a classic disease. It's vitamin C deficiency. And the British knew that something in lime prevented scurvy. Now, scurvy will kill you. It's a terrible deficiency to have. When I was a medical student, we admitted a young man from the city of Baltimore. Actually, was a kid with classic scurvy. He was bloated, his heart was failing, he was going to die. And the history was he was getting a glass of orange juice every day. Well, when we asked the mother how she prepared his orange juice, she was boiling it, just like she did his formula. And vitamin C, unfortunately, is heat sensitive. So he gave him a dose of vitamin C and he walked out of the hospital. But scurvy, they didn't know what it was. They just knew that something in citrus took care of it. And then you have A vitamin deficiency with keratomalacia. This is a problem in parts of the world that eat rice. And we developed a golden rice, which was fortified with vitamin A to help that. Goiter, your thyroid gland got large because you needed the iodine, which you didn't get. And now if you look at all your salt, it's fortified with iodine to prevent that. Iron deficiency anemias, we still have that. And some years ago, the U.S. government, in their infinite wisdom, discovered that a dose of saturated iron oxide, which we used to inject for iron deficiency, in 10 times the human dose in rats caused a problem. So they took it off the market. Well, we were using it for like 50 years. It never caused any problem in people. And now we said, okay, what do we do now to treat these iron deficient people? So it's back on the market again. We have lots of insect vectors. And you know about mosquitoes, but we have ticks, fleas, flies, and lice, which carry other diseases, most especially Lyme disease, dengue. Mosquitoes spread a lot of disease. Dengue fever, West Nile virus, yellow fever, Zika, malaria. There's nothing good you can say about the female mosquito. Now, the reason the mosquito bites us is because it needs a blood meal to produce eggs. And so we are just one of its sources of nutrition. We have other diseases which were not a problem in this country, but are problems in other parts of the world. Now, vaccines, despite what our new Surgeon General says, are really the greatest advance in preventative medicine, period, full stop. The original was smallpox. Now, the smallpox vaccine was not against smallpox, it was really cowpox. Jenner, way back when, discovered that the milkmaids didn't get smallpox. And smallpox is a terrible disease. If you've ever seen pictures of it, not only is it lethal, but if you survive, you have all these scars on your face and parts of your body. But the milkmaids kept a clear skin. And so he discovered that if you infected somebody with cowpox, it prevented smallpox. When I was a resident, cowpox can produce a condition where you have pox also, but it's relatively mild. And so then we have our vaccines, the so-called DPT, the diphtheria, pertussis, and typhoid, which are three really nasty diseases. Diphtheria, you basically have tissues in your throat that swell up and you're gasping for breath. Pertussis, you have whooping cough, which is so bad that it gives its name by the whoop that you have when you try to take air in. And typhoid is just plain old miserable. We have tetanus toxoid to prevent lockjaw. When I was a kid, measles, mumps, and chickenpox were routine. That was the passage of childhood. I got all three of them in 1 year. And That was it. Now we give the kids a vaccine and they don't have to go through that. The problem is you now have a susceptible population. And if you get chicken pox as an adult, it can be deadly. As a childhood disease, it's not too bad, but in an adult, it's another story. And then, of course, we have COVID and the other influenza vaccines, which are great. And now we have vaccines against shingles, typhus, and yellow fever. So we have vaccines against diseases that are really terrible diseases. So modern medicine is really a modern miracle. We have modern hospitals. We take for granted sterilized operating rooms, imaging. We have trauma centers. We have emergency rooms. And if you have an accident or an injury, you have a golden hour or two to really keep the patient alive and to do things. We have modern outpatient clinics for non-life-threatening conditions. And now we have telemedicine, where most of the imaging is done by the internet. And the electronic imaging is every bit as good as the old X-ray, and a lot of it's better. Some of the things that we have today, I wish I had when I was in training. But things like sterile technique that we take for granted, it took a long time for that to be recognized as something that needed to be done. And now we have surgical scrubs. We have positive flow of air in the operating room so we don't take in possibly contaminated air from the outside. If you've ever been to a modern pharmacy, which is doing compounding, you have positive flow of air, you have ultraviolet light, the people are wearing masks and hats, the caps. And so it's really a whole different thing. We have things like sutures that you take for granted, which are fabulous, which we didn't have in the past. And now, in addition to sutures, we have glue. And the glue that we use is really basically cyanoacrylate glue. It's crazy glue, but it works beautifully. We take for granted modern anesthesia, but we didn't get ether or chloroform until the 1840s. And so it was widely used during the Civil War, but before that, surgery was brutal. The modern ether that we have today is not ethyl ether. I was given ethyl ether anesthesia in the 50s when I had a hernia done. It's good, safe anesthesia, but it goes into the fat stores of your body. And for the next 6 weeks, it's coming out in your lungs and your GI tract. You can't be in polite company because you're belching and farting for the next month. The ether we have today is different. It's a chemical ether, but it's not the old-fashioned ether. And so today you give the patient pure oxygen, you blow off the ether, they're awake and alert within minutes. So it's a tremendous improvement. Local anesthetics, we've improved on those. Cocaine will always be with us because it's one of the few anesthetics that constricts blood, and there's no substitute for it for operating on the eye and the nose. We have so-called conscious sedation, which is kind of light anesthesia. So you don't have to intubate the patient, but you can do, like I had my carpal tunnel surgery done under conscious sedation. And then something that you wouldn't think was important, but you have various cylinders of gases on anesthesia machines. And it wasn't until we had a few disasters that they key-coded them. So you can't put an oxygen cylinder where a nitrous oxide cylinder should be. And you'd think something as basic as that would be standard, but it took a while to get there. The biggest change has been in the lifespan. And it's a little hard to see in the graph, but the lifespan was fairly low in the mid-30s until about the 1900s. And then it took a sharp uptick. And so 19th century, the average life was, about 35 years. You were an old man then. In 1950, we're up to 48 years. And now we're up to somewhere like 73 years. And if you look at everybody here at Oak Hammock, we're up there in the 80s and 90s, and some of them are even in the 100. But if you look at the prehistoric lifespan, for most of the human existence on Earth, 40 years was pretty much it. There was one interesting exception. In the 1600s, Samuel de Champlain visited Canada, and he found some people that were in their hundreds, 90s and 100s, and he decided that they existed that long because they had low stress, they had a good diet, and they ate diverse vegetables and various things. So it isn't a given that you have to go at age 40. One of the biggest things that we've done has been the discovery of insulin. And before 1922, when Banting and Best discovered insulin, everybody who was a diabetic was a type 1 diabetic. We didn't know about type 2 diabetics. But the duration from diagnosis to death was about 3 years. You basically wasted away. And if you look at the medical literature at the time, various diets were used. People were on liver diets, they were on other diets. It was the discovery of insulin and the discovery that it was in the pancreas, in the beta cells, that we were able to do something with these people who are diabetic. And then in 1978, we learned how to make human insulin. Before that, as I mentioned, every pancreas from every animal, from every abattoir in the United States went to Eli Lilly to produce insulin. Now E. coli gives us human insulin, and that's been a tremendous improvement. But in addition, besides the injection, we now have the insulin pump, which can help us control the most difficult diabetics. And now we have insulin which can be inhaled, and we have the blood glucose sensors which fit under the skin. So we have a huge improvement in the way we can control diabetics and keep them in control. The vitamins are a fascinating story. They were all discovered around the 1930s or before. Actually, vitamin A was discovered in 1913, the B vitamins 1910 in the 20s, and then finally around 1948, we got the last of them, vitamin B12. So if we take a look at them one by one, vitamin A is important. It prevents rickets, it prevents sclerodermalacia, and it's a fat-soluble vitamin, which means you get it in meat and fats, but you can also get too much of it because you'll store it in your body. And if you take too much vitamin A, it will affect your bones and other things. We have a whole list of B vitamins. They're water-soluble vitamins, which means you can't store them in your body. You have to take them because they're excreted in the urine. But if you start out, you see the conditions that were once considered diseases, like pellagra, beriberi, and finally pernicious anemia, which is controlled by vitamin B12. But we need the B vitamins if you get them in green vegetables. And if you have a normal, varied diet, you'll get all the vitamins you need. Vitamin C prevents scurvy. Citrus is a great way to get it. But vitamin D is fat soluble, and you need it to get good, strong bones. You can get it from fish. You can get it by exposure in the sun also, but probably not enough. Vitamins E and vitamin K are important. Usually they're not really associated with any deficiencies. Vitamin K is important in blood clotting. So if you're on a blood thinner, like warfarin, and you need to be reversed, they give you a shot of vitamin K that reverses it almost immediately. So what we have now are fortified foods that protect us from ourselves. All the milk is vitamin D fortified to prevent the rickets. The salt has iodine. If you look at your flour, your rice, your corn, It's fortified with iron, B complex, vitamin A, zinc. We have folic acid to prevent neural tube defects in the young. And then we have all our medical machines. We have heart-lung machines so we can do surgery that we never could do before, dialysis, modern anesthesia machines to breathe, operating microscope, so we do microsurgery now. And that's important for the eye, the ear, the vascular surgeons. And then we have all this other things, lasers, ultrasound, radiation, to allow us to treat things that were really untreatable before. And we're lucky to have them, and more things are coming. We have new medicines that can cure previously lethal diseases, and like some leukemias, viral diseases. We can cure previously incurable diseases. The classic is hepatitis C. A series of treatment will cost close to $50,000, but it's curative. And so our problem now is some of our drugs are too expensive, but we have them, and we can cure diseases that we could not even treat before. And so we have a lot of previously untreatable conditions that we now can do something about. And so what's the future? Well, the future is we're going to treat more incurable disease. We're going to be using immune therapy more, especially for treatment of cancers, where instead of giving you drugs that are basically poisons, and they work because they poison the cancer more than they poison us, but we're targeting cancer cells with immune products so that we target the bad guys and not the good ones. We have genetic medicine now for inherited disease, and that's the big topic in medicine now. We're going to cure more and more of these so-called inherited diseases. We have robotic surgery, and this is a phenomenal improvement because robots don't get tired. And they're very expensive, but they're quite good, and we're using them more and more. And then we have more exotic treatments like lasers, radiation, heat therapy, and targeted medication. So it's a good time to be around, and I'm sure in the future they'll look back on us and say how crude we were. But compared to what we had over 90 years ago, we've made phenomenal progress. In fact, all of modern medicine happened in the last 90 years. So when we look at everyday magic, it's everywhere. We live better, more comfortable lives. The most interesting thing is we consider that the human life expectancy is about 100 years. And the goal is to do that being physically sharp and mentally sharp. In other words, you want 100 years of really good quality life. And I think we're in the verge of getting just that. Some places I've read, they say that the human lifespan should be somewhere in the order of about 150 years. And that's because of the way our cells normally age. But, you know, right now we're getting close to it. If you think about it, 4/5 of the people here would not be here if it weren't for modern medicine. There wouldn't be an oak hammock. So we have a lot of magic in our everyday lives, and medicine is one of the truly modern miracles that we have. So I thank you all. I hope it's been of interest to you and that life has been less mystifying. And if you have any questions, I'll be glad to take them. Yes, please. The various salts are colored because of the various minerals they have. So I don't know if they do or they don't, to be honest with you. But if you look at the label, it will probably tell you if it has iodine. I think it has to, because a lot of the exotic salts that they're using do not have iodine. I mean, Morton's, you'll see on the label, it's iodized, and that's by law. So I really don't have the answer to your question, to be honest. Oh, yes. Well, my point of view is that if you eat a normal diet, a well-balanced diet, and you don't have a malabsorption problem, you'll get all the vitamins and minerals that you need. And so the joke used to be, if you take a B vitamin supplement or a C vitamin supplement, you may as well toss it in the toilet and avoid the middleman. But the thing is, we get most of our vitamins that we need. The good thing about the so-called yellow rice was that it gave vitamin A to people who were otherwise deficient. But so if you have a deficiency problem, like some people cannot absorb B12, and so you have to take a supplement. But for most of us, if we don't have a deficiency or a malabsorption problem of some sort, we eat a varied diet, vegetables, salad, meat, fish, eggs, you will get everything that you need.
There's a question on Zoom, but let's get some people over here.
Yeah, you listen to your doctor if they tell you to take this or that. Let them test for it. But I just wanted to add something, a little anecdote, and that is when my father was a child in Russia, he got he told me his leg, he got a very bad infection on his leg. So they went to the woman, I don't know what they called her. She was like the medicine woman.
Felchers.
And she put moldy bread on it.
That's right.
For penicillin, and changed it, came back and he changed it every day and he survived. But
Well,
it was that's kind of interesting.
Well, penicillin is bread mold. That's where we get it from. That's right. And, when in the old days, they used to put poultices on, and that's where we get most of our drugs from plants. So, she was doing the right thing.
Rick, you have a question? Can you go ahead, unmute? Oh, hold on a second. I think I got to help him. Hold on.
There's a question in the,
Is there another question in the back?
yes, there is.
Oh, well, let's get her while I'm helping Rick. Okay, hold on.
I don't want to cut off Rick.
Well,
So, you go to the doctor and you get a prescription, and should smaller people get less dosage than larger people?
Well, yes. In fact, the pediatricians have a whole separate dosage of the drugs that they give. So for adults, it's not much of a problem, but for children, yes, the doses are less.
Okay, because it seems like, for adults, they give the same amount for a given situation, but you're saying with adults, maybe it doesn't make that much difference.
Well, for adults, we don't vary that much in size over too wide a range, but for pediatrics, it's milligrams per kilogram when you figure out the dosage of what you want to give in the way of a drug.
I see.
In other words, you go by the weight of the child.
Thank you.
Okay, Rick, you there?
Yeah, thanks.
Go ahead.
A couple of sort of interrelated questions. I've been reading about the confrontation of the Native Americans with the incoming Europeans and how disease was just really devastated them. It just seems like, okay, well, why didn't populations become devastated wherever the Europeans went if they were not, really open to.
Well, actually, they did, because it wasn't just North America, it was Central America, South America, where measles and smallpox did the job. And now in return, the Indians gave us syphilis. So
Well, actually, that was going to be my next question.
Yes. In other words, it was a mutual exchange, I think.
Great, thanks.
Yes.
Another question?
Yeah, it's Larry Lowenthal. We're fortunate at Oak Hammock that we have access to full meals and full nutrition, but tens of millions of Americans do not, and the supplements can help them.
Oh, yeah. Well, the supplements help tremendously. But back in Baltimore, people were harvesting the collard greens, which grew as weeds. and they're really quite nutritious. And some of the avant-garde chefs are actually doing the same thing. They're serving collard greens. So there's a lot of nutritious food out there. But as I said, hominy grits isn't one of them.
Yeah, another question.
In my hometown in Wisconsin, which was a small town on the Wisconsin River in the paper-making community, we got goiter pills all through grade school. I don't remember getting them in kindergarten, but as soon as I got to first grade, once a week, the nuns would pass out goiter pills.
Right. Potassium iodide.
And that was I guess the salt at that time did not have iodine. And when the salt then became manufactured with iodine, there was no need for the goiter pill.
That's true.
But I think that's pretty amazing that we were en masse getting these pills without being tested, without anything, when nowadays you can't even get vaccines without uproars from a portion of the people who believe in nonsense.
Well, it varies with the time. I remember when we had the polio vaccination, everybody was for it. There were no problems. There was no political fallout. We just did it, and we vaccinated an entire population against polio. Now people are concerned, what am I putting in my body? Well, what you're putting in is good for you.
This is a follow-up question to that one. If iodine is such a central feature of your diet, why isn't it in more table salt? You actually have to search in the supermarket for iodized salt, yet I don't know how many other sources that you have for iodine.
Well, if you use Morton salt, it's got iodine in it. Not all of it? I can come without iodine? Okay. Most of it, I think, is iodized.
You had a question?
Right.
Well, as Rick said, we in Ocambic have access to variety of good, healthy foods, and I don't think very much about what I eat. I just eat it. But I also, for some reason, which I don't remember, take a 1-a-day vitamin. Can you overdose on vitamins?
You can overdose on the fat-soluble vitamins, namely vitamin A, vitamin E, vitamin K. Well, vitamin K nobody does, but vitamin E and vitamin A you can overdose on. And all the the water-soluble vitamins, your kidneys throw them out. 1 a day is not going to bother you. In other words, you really have to take a lot to get hypervitaminosis.
How do you feel about the government now with the anti-vaxxers and what's going to happen with starting with school kids?
Well, I think all the school kids should have DPT. Everybody should have a polio vaccine. It's questionable now about smallpox vaccination because smallpox exists only in 2 laboratories in the world, in the US and in Russia. And we're going to have a generation of young people that are susceptible to smallpox. Now, all of us have been vaccinated, so we're not at risk. But that's a problem if there's a biological war. We're susceptible to a lot of these things. But vaccines are a tremendous public health improvement. There's no question about it. If you've ever seen a case of diphtheria or polio, I remember seeing rooms with iron lungs from polio. And there is no treatment for polio. I mean, you support the patient, but we don't have a magic bullet or a drug that will knock out the polio virus. The vaccine is the greatest thing since sliced bread.
Okay, I'm on my way.
Well,
Thank you. So you mentioned ivermectin in a positive light, and some people like my cousins take it when they get COVID. And I've heard that that's not a good idea. What do you think about that?
Ivermectin is a wonderful drug if you've got a worm, and that's its use. If you've got a worm, you want ivermectin. It is not a treatment for COVID. In other words, you don't give an antibiotic if you're vitamin deficient. You use the appropriate drug for the treatment that you need. But ivermectin's a wonderful drug. It's used in the veterinary industry all the time.
So all these medications come at a cost. And as we look at more obscure diseases, the cost for curing them doesn't go down. I mean, the question as a society, how do we afford to keep everybody alive?
Well, that's a problem I don't know how to address. Now, as far as, as far as the vaccines and the other things, we have a problem now. We got too many old people. We don't have enough young people in our society. I don't know. I mean, our goal is to keep people productive. We've increased the age at which we can retire or should retire. In the old days, people did a lot of physical labor. They were worn out by the time they were 65. Now we don't have people digging coal out of coal mines. We have big machines that do that. And if I think about the way my mother used to wash clothes by hand, and now we have washing machines and, dryers and things. So a lot of physical labor's been taken over by the machines. So we're living longer. We're not wearing out as much. What was the first part of your question?
Well, as as we address more obscure diseases, the
Oh.
cost to treat
Right,
one
about the
individual
vaccines.
becomes exorbitant. And, how can we as society afford to treat everybody ultimately?
Well, I think we can. Malthus said that society would outstrip the food supply, and yet we've managed to increase the amount of food. And for the first time in history, we have excess calories. So we have a problem with obesity worldwide, not just here. So, but as far as vaccines go, yes, there's some people who will get Guillain-Barré, and there's a trade-off, but it's a very small number. And it's true with every drug that I prescribe. There's somebody who's going to have an adverse reaction, but it's a trade-off. So that's a trade-off. We have more old folks.
Any other questions?
If you can remember the movie Logan's Run, where at age 21, I think it was, you were scheduled to die. Was it 30? Okay. So that's right. Well, thank you all very much for attending.
Thank you, Joe. It was good.